I was taking 7 medications prior to my surgery. I take 1 now.
Since the 1980s, obesity has been increasing throughout this country from, in a lot of states, less than 10% to over 30% in some states at this time.
Right here in Utah, 50% of all the deaths in obese women from cancer come from being obese, and 30% of all the deaths from cancer in obese men come from being obese.
Obesity is catching up to tobacco as the leading cause of death in America. If this trend continues, it will soon overtake tobacco. Centers for Disease Control and Prevention.
When we talk about obesity, we talk a lot about comorbidities. And comorbidities are medical problems that are caused by or made worse by being overweight. So there are things like diabetes, high blood pressure, sleep apnea,
hypertension, cancer, stroke, swelling of the feet and ankles, infertility.
They see their doctors more often, they take more sick leave, they have more time off work or being suboptimal at work because of joint issues or sicknesses. But we know that the vast majority of patients who have those comorbidities, those can be eliminated by weight loss from surgery. The National Institutes of Health actually does classify obesity as a disease.
Severe obesity is a chronic condition that is difficult to treat through diet and exercise alone. Gastrointestinal surgery is the best option for people who are severely obese. National Institute of Health.
They also say that, being able to lose weight and keep it off, only about 1% or fewer than 1% are able to do that. I would say it's rare enough that you get to be on the cover of People magazine if it happens. The reality is that it doesn't happen very well with diet and exercise.
The chance of losing weight through diet and exercise alone is only 1 in 1,000, while the chance of losing weight with surgery is approximately 80%.
Obesity problems in the United States. Obesity is one of the leading causes of preventable death. Obesity contributes to 50% of cancer deaths in obese females and 30% of cancer deaths in obese males. Obesity is the primary contributor to type 2 diabetes, sleep apnea, cardiovascular disease, and hypertension. And it is estimated that obesity causes 300,000 deaths annually.
Patients who are overweight find that they suffer discrimination at work. They a lot of times can't get advancement. They are often ignored by other people who just don't even look at them when they walk by on the street. They have a hard time finding seating in theaters, restaurants, in airplanes.
Obesity affects the ability of people to feel human. They can't get in and out of a car. They can't play with their kids. They can't go to the show. They can't get on an airplane. It limits their ability to enjoy the freedoms that thin people enjoy.
Social and physical drawbacks include various discriminations, limited physical mobility, seating issues, and clothing limitations. Now, how is obesity determined and when should a person consider surgery? We start with a BMI, or body mass index. It measures body fat based on height and weight. For example, this graph shows a woman that is 5 feet 4 inches tall, weighing 255 pounds. Her BMI is 43.8. To check your BMI, visit thinbeginnings.com and click on the BMI calculator. We consider surgery when a patient has a BMI over 40 or over 35 with medical problems, when a patient has been unsuccessful with previous weight loss attempts, when a patient is committed to a lifestyle change and agrees to a lifetime of medical follow-ups. Also, some patients with BMIs lower than 35 can be considered for surgery. A consultation with a surgeon would be necessary to make that decision.
My name's Charles Fox. I go by Bill.
My name is Tina.
My name is Letitia Grimmett, and this is my husband, Derek.
Well, I've lost 143 pounds in 5.5 months, and I've lost 10 inches around my waist. I was wearing 44-inch pants. Today I'm wearing 34s. The last time I wore 34s, I think I was 20 years old. I'm now 50, so yeah, it's totally awesome. So
I weighed 464 pounds. Today I weigh 254 pounds. I've lost exactly 210 pounds. And I chase my year-old grandson around the yard like it's nothing.
Officially, my weight, that when I stood on the scale and just kind of came to grips, was 286 pounds.
I was taking, I think we were talking earlier, 6 or 7 different medications before my surgery. One of them, I was a needle diabetic.
I had acid reflux, really bad. Attacked me almost nightly. I couldn't do anything with it.
My health conditions got worse. Doctors were flagging me. It was like bells were going off when I come in for my appointments. Ding, ding, ding. Oh yeah, you're the one with the A1C above 12. And my blood pressure got heavier and the medications kept getting switched and nothing was helping me.
After the surgery, I have not had heartburn, let alone acid reflux. It's gone. Totally eliminated.
The fact that I've never had to touch a needle since the day of my surgery is just awesome.
1 week after the surgery, she didn't have to take any of her medication.
Yeah.
She didn't have to take her diabetes, her
High
insulin.
blood, no.
She didn't take her high blood pressure pill. She didn't have to take many of about 6 different pills you had.
I did. Then
I can't even name half of them.
I was taking 7 medications prior to my surgery. I take 1 now.
one of the most amazing things medically about the surgery, and nobody can understand it, is when you have those health problems, the miracle of it disappearing or almost going away soon after surgery. I have yet, it's over a year.
I feel it was the best thing I ever did for myself. The best thing I could have done for myself health-wise, because my health is totally back to where I need. I have more energy now than I ever had before.
Every day I see myself in the mirrors, I laugh. Gosh, look at me. I don't have any of my clothes anymore. I actually officially gave away every one of my clothes that I used to wear.
I can't stress enough on the fact of my grandkids. Being able to play with them is just the ultimate.
I just thank God for the change. This surgery was like gave me new life. It really did.